Peripartum depression, more commonly known as postpartum depression or PPD, is a condition that affects between 15 to 20% of new mothers. Adolescent mothers are at an increased risk for developing PPD, with an estimated 30% of adolescent mothers suffering from the condition. In this video, we will go through what PPD is, risk and protective factors, treatment, and more. This video was created by the Postpartum Depression Awareness Campaign. We are a student-run organization that aims to increase awareness for PPD in teen mothers. This video will be broken up into 6 sections: defining PPD, how to identify PPD, risk and protective factors for teen mothers, options for treatment, how to find support, and what you can do if you know someone suffering from PPD. According to the American Psychiatric Association, peripartum depression, formerly known as postpartum depression, refers to depression occurring during pregnancy or after childbirth. The term peripartum is now used to acknowledge that the symptoms of depression often start during the pregnancy itself. Typically, PPD can last up to 1 year after the baby is born, but symptoms can persist past this point. PPD has a negative effect on both the mother and child. For the mother, PPD can be emotionally and physically devastating. It can deeply affect quality of life and the bond the mother forms with her child. Bonding issues can cause problems with the baby as well, such as sleeping or feeding problems. Children whose mothers suffer from PPD are also more likely to have social, emotional, and cognitive deficits. The risk of this decreases when mothers are able to receive treatment. Around 50 to 75% of people experience the baby blues after the child is born. PPD is often mistaken as baby blues, so it is important to be able to distinguish between them so PPD can be treated. The baby blues typically last a few days to 2 weeks after the baby is born. Symptoms include mood swings, anxiety, sadness, irritability, excessive crying, feeling overwhelmed, concentration issues, appetite problems, and trouble sleeping. These symptoms will typically subside without treatment. PPD may be mistaken for the baby blues at first, but one way to distinguish them is that PPD is much more intense and lasts for a longer period of time. Symptoms include severe mood swings, excessive crying, difficulty bonding with the baby, withdrawing from loved ones, extreme loss or gain of appetite, insomnia or sleeping significantly more than usual, overwhelming loss of energy, intense feelings of irritation or anger, feelings of hopelessness, shame, or inadequacy regarding your ability as a mother, reduced concentration and ability to think clearly, restlessness, severe anxiety and panic attacks, fear of not being a good mother or hurting the baby, or recurring thoughts of self-harm or suicide. A condition that is much less common than the baby blues or PPD is postpartum psychosis. This condition only affects around 1 in 1,000 mothers. Symptoms include feelings of confusion, having obsessive thoughts about the baby, sleep issues, hallucinations, paranoia, hyperactivity, and attempting to harm yourself or the baby. The symptoms are much easier to distinguish from the baby blues or PPD. Postpartum psychosis is an incredibly serious condition that requires immediate treatment due to the increased risk of harm to the mother or the baby. The baby blues and PPD share many symptoms, but there are clear distinctions between the two. It is important to talk to your doctor if you feel your symptoms go beyond the usual baby blues. Common risk factors for PPD include a stressful event that occurred during the pregnancy or shortly after delivery, medical complications during pregnancy or childbirth, mixed feelings about the pregnancy, and a lack of emotional support from the father, family, and friends. While these risk factors also apply to adolescents, they also face unique risk factors that may not apply to adult mothers. Adolescence is a critical period in development where coping skills and cognitive ability are still developing. This is why adolescents have an increased risk of developing depression compared to adults. The physical, mental, and emotional demands of motherhood can exacerbate this, leading to a higher rate of PPD among teens. Teen mothers are also more likely to be of a lower socioeconomic status, lack familial support, have lower levels of education, and lack maternal competency. The societal stigma against teen mothers also means they are often unsupported socially. Teen moms have an inherently higher risk of developing PPD, so it is important to be aware of protective factors that can help recognize and treat the condition early or reduce the severity of it. According to a study on PPD in adolescents conducted by researchers at the University of Alabama, the main struggles of adolescent mothers with PPD are stigma, lack of social and professional support, lack of knowledge about PPD, and barriers to accessing support. Therefore, effective protective factors would combat these issues. On a systemic level, reducing stigma surrounding teen pregnancy through spreading awareness and putting better structures in place so that teen mothers are able to access resources easily would help mitigate rates of adolescent PPD. Creation of resources that will educate teen moms and guide them to resources they may not have been aware of can also help, which is the purpose of our campaign. Support groups have also been identified as a protective measure against adolescent PPD. It is important to recognize that PPD is a medical condition. The solution is not for the mother to simply get it together, and experiencing PPD does not make you a bad or inadequate mother. You are not alone in this experience, and there is no shame in having PPD or needing treatment for it. The most important thing is being able to recognize your symptoms and receive treatment. PPD is managed with treatment options that are used to combat depression, such as psychotherapy and antidepressants. Psychotherapy is also known as talk therapy and involves one-on-one talk with a mental health professional. The point of this treatment is to help the mother understand what she is feeling and develop coping skills to manage her condition. Group therapy, where one mental health professional works with multiple patients at the same time, is also a possible option. Antidepressants are another option. Antidepressants are medications that help regulate the levels of certain chemicals in the brain in order to combat depression. Most antidepressants are safe to use while breastfeeding, but it is necessary to discuss with your doctor what option is best for you. Antidepressants are most effective when combined with psychotherapy. Brexanolone, also called Zulresso, is another option. It is the only drug on the market that specifically targets PPD. It is given through injection. However, it is incredibly expensive, with a single dose costing up to $34,000. It isn't the most accessible option, especially for adolescents. Psychotherapy and antidepressants are also hard to obtain for those who can't afford them or don't have insurance. Contacting your state's Department of Public Health or county government is a good place to start, as they can direct you to community-based clinics near you that offer services for lower prices. Nonprofits such as the Open Path Psychotherapy Collective can help you find relatively cheap therapy for a lifetime fee of $59. Group therapy is also a good option because it can be cheaper or even free depending on the group. The Substance Abuse and Mental Health Services Administration can also guide you towards helpful resources. These will all be linked below. Medicaid is also a good option if you need access to medication. Resources related to Medicaid will also be listed below. As stated earlier, strong support from loved ones in your community is a significant protective factor against PPD. Postpartum Support International has many resources on their website, including online support groups connecting with local volunteers and specialized support resources which include resources targeted towards teen and young adult parents. They also have educational materials that can be helpful for adolescent mothers struggling with PPD. Postpartum Progress has support networks organized by state, as well as specialists located in each state that can help treat PPD. They also offer a private online community where you can talk to other moms who may share your experiences. Local hospitals, family planning clinics, and community centers are also a potential source of support. Creating an effective support system can be difficult, especially if your community is unsupportive, but there are many accessible options for teen moms suffering from PPD. Strong support from family and loved ones is incredibly important for those suffering from PPD. An initiative from the National Institute of Health called Mom's Mental Health Matters offers 4 suggestions for loved ones who want to help. The first one is to know the signs. This can be done by being knowledgeable about the symptoms of depression and anxiety, so you can recognize them if they appear. The second is to listen to her. Opening up communication can allow her to speak about things she may have felt ashamed of saying unprompted. The third is to give her support. Offering help, like watching the baby for some time or helping with her other responsibilities, can let her know that she isn't alone. The fourth is to offer to help. She may not be aware of what her symptoms mean or may feel uncomfortable reaching out to a healthcare provider. Going through her options with her can make her feel more comfortable reaching out. We hope this video was helpful for you, whether you are a teen mom who may be struggling with PPD or someone who is trying to find resources for a loved one. We have accounts on other platforms that will be linked below if you would like more information. Thank you for watching.